Green tea contains nutrients and antioxidants that provide many health benefits, from reducing the risk of heart disease, cancer and diabetes, to increasing longevity and improving brain function. L-theanine, an amino acid similar to glutamate and glutamine, is another component abundantly found in green tea. It's been specifically investigated for its potential to improve cognitive function and to curb anxiety. Green tea is also a rich source of minerals. Green tea has a high content of antioxidant compounds. It's approved for genital and anal warts. It can help to prevent heart disease, some types of cancer, diabetes, improve cognitive function, improve oral health, and help to lose weight. A topical ointment with green tea extract was approved by the FDA in 2006 for the treatment of genital and anal warts. In 4 clinical trials on over 2,200 people, it was effective and well tolerated. A meta-analysis of 9 studies on almost 260,000 people associated green tea consumption with a reduced incidence of heart disease. It was dose-dependently associated with fewer heart attacks. Drinking over 10 cups a day was associated with lower LDL levels. Its flavonols were identified as the protective compounds in another meta-analysis. This protective effect seems largely due to its ability to lower blood pressure and to improve blood fat profile. Multiple meta-analyses of clinical trials found that drinking green tea reduced blood pressure, total cholesterol and LDL cholesterol. The evidence suggests the green tea can help to prevent heart disease by lowering blood pressure and cholesterol, both total and bound to LDL. In 2 studies on over 350,000 Japanese elderly people, drinking more than 3 cups per day was associated with lower rates of death from all-cause mortality, heart disease, stroke and respiratory disease in both genders, and from cancer in women. In another study on over 14,000 Japanese elderly people, drinking green tea was associated with a 76% lower mortality during a 6-year follow-up period of the study. Green tea was associated with reduced death from all-cause and heart disease, as well as lower incidence of colorectal cancer. Polyphenols in green tea protected telomeres from shortening in cell-based studies, suggesting their potential to increase longevity. Oxidative damage can trigger several cancer types. As a rich source of antioxidants, green tea can help to prevent them. In an observational study on almost 70,000 Chinese women, regular consumption of green tea was associated with a reduced incidence of colorectal cancer. 4 meta-analyses associated drinking green tea with a lower incidence of colorectal cancer. In 2 clinical trials on 276 people, supplementing with green tea extract reduced the incidence of colorectal cancer type, metachronous colorectal adenoma. In a study on over 4,000 French women, consuming green tea and other antioxidant beverages was associated with a lower incidence of breast cancer. However, a study on over 15,000 women failed to associate regular green tea intake with breast cancer. In a small clinical trial on 12 women with breast cancer, a formulation with epigallocatechin gallate, or the EGCG, effectively delivered the polyphenol into the blood and the tumours, and it reduced a biomarker of breast cancer. Meta-analyses found a slight trend towards reduced breast cancer incidence in women who are drinking high amounts of green tea, although they generally considered the evidence insufficient due to the high heterogeneity of the studies. The most recent meta-analysis did find that green tea was effective at protecting from breast cancer, especially from its reoccurrence. In an observational study on almost 50,000 Japanese men, green tea consumption was associated with a reduced frequency of advanced prostate cancer. 2 meta-analyses concluded that the green tea, but not black tea, can help to prevent the prostate cancer, especially in Asians and in people taking over 7 cups a day. However, another meta-analysis of 21 studies found no association. In a clinical trial on 60 men with a condition that often develops into prostate cancer, high-grade prostate interepithelial neoplasia, The daily treatment with green tea catechins helped to prevent this type of cancer. However, a small trial on almost 100 men at risk of prostate cancer found green tea was ineffective as a preventative measure. Nonetheless, a meta-analysis of 13 studies found green tea slightly effective. Although they reduced the levels of prostate cancer marker, or PSA, in some studies, green tea polyphenols had little or no effectiveness in preventing prostate cancer in most trials on people without high-grade prostate interepithelial neoplasia. One of them even associated green tea supplements with an increased incidence. Green tea polyphenols reduced liver cancer biomarkers in 2 clinical trials on over 200 people at a high risk of developing the condition. 3 meta-analyses found an association between green tea intake and reduced incidence of primary liver cancer. In 2 clinical trials on over 200 heavy smokers, drinking green tea reduced oxidative damage to the DNA, possibly reducing the risk of lung cancer. 3 meta-analyses concluded that green tea may have protective effects against lung cancer. However, a small trial on 17 people with advanced lung cancer found that green tea was ineffective as a chemotherapeutic agent. 3 meta-analyses associated green tea consumption with a lower incidence of ovarian cancer. In a clinical trial on 59 people with mouth lesions that can develop into mouth cancer, oral leukoplakia, drinking green tea and applying it topically reduced the size of the lesions and some of the markers of oral cancer progression. A meta-analysis of 14 articles on over 4,600 people associated green but not black tea consumption with a reduced incidence of oral cancer. In 3 pilot trials on 87 people with leukemia, green tea extract reduced lymphocyte counts. Studies investigating the potential preventative role of green tea on the following cancer types produced mixed results. This was on bladder cancer, endometrial, stomach, esophageal, and pancreatic. Mouth rinses with green tea extract reduced plaque buildup, gum inflammation, and the salivary counts of microbes that can cause cavities and gum disease, like Streptococcus mutans and lactobacilli, in clinical trials on 225 people. Green tea extract also inhibited cavity-causing bacteria, S. mutans and S. salivarius, in test tubes. Similarly, the epi-galligo-catechin gallate reduced the growth of the S. mutans when incorporated into a dental glue. Mouth rinses with green tea reduced dentin wear in 2 small trials on 22 volunteers. Chewing gum with green tea even remineralized enamel lesions in another trial on 45 people. A green tea gel applied after a non-surgical treatment reduced gum bleeding and inflammation in a clinical trial on 48 people. Similarly, a mouthwash with green tea reduced pain after tooth removal in another trial on 48 people. Oral green tea tablets reduced the compounds that cause bad breath, the volatile sulfur-containing compounds, in a clinical trial on 54 people. The existing evidence suggests that green tea may improve oral health by preventing infections, protecting the enamel, and reducing inflammation and bad breath. Epi-galligo-catechin gallate, caffeine, and L-theanine all may work to improve brain function and health. The amount of caffeine found in green tea is enough to help to improve memory and reaction time, as well as to boost dopamine and norepinephrine in the brain. In a clinical trial on 12 healthy volunteers, green tea extract improved brain activity in a key region of working memory processing, the dorsolateral prefrontal cortex. Green tea increased brain activity, especially theta waves, in another study on 8 healthy volunteers. This suggests its potential to improve alertness and attention. L-theanine especially increased alpha waves, which are associated with mental alertness and arousal, in another trial on 35 healthy people. A combination of green tea extract and L-theanine improved memory and attention in a clinical trial on 92 people with mild brain damage. In another trial on 27 elderly people with cognitive dysfunction, drinking green tea did not improve their symptoms, but it reduced oxidative damage, possibly helping to reduce their progression. Epigallagocatechin gallate, or the EGCG, improved visual recognition, memory, working memory, inhibitory control, and adaptive behavior in 2 clinical trials on over 100 people with Down syndrome. It also improved cognitive function in mice with this condition. In a meta-analysis of 7 studies and over 286,000 people, drinking green tea was associated with an 18% lower incidence of type 2 diabetes. Its potential to improve blood sugar control in people with type 2 diabetes or at risk of developing this condition is less clear. While it was effective at reducing fasting blood sugar in 2 meta-analyses and fasting insulin at high doses in one of them, a third one found the green tea ineffective at lowering type 2 diabetes markers in people who are at risk. The differences observed may be due to the heterogeneity of the populations. A meta-analysis found the green tea especially effective at lowering fasting blood sugar in people below 55 years of age or of Asian origin. The effects of green tea on weight loss have been tested in multiple clinical trials. Although several studies found that it helped, the results were modest and mixed. 3 meta-analyses of 44 studies found that green tea and its catechins promoted a slight weight loss. A meta-analysis of 8 studies found they may do so by promoting fat burning and energy expenditure. However, 2 other meta-analyses of 21 studies concluded that green tea catechins only promote burning of fat in combination with caffeine. Green tea had no effect on the appetite hormones leptin and ghrelin in a meta-analysis of 11 trials. A topical application of creams with green tea extract improved skin elasticity, it reduced wrinkles, and it protected from the harmful effects of UV radiation, aging, burns, and immunosuppression in 5 clinical trials on 87 people. However, another trial on 40 women found it ineffective. The results of trials using oral green tea polyphenols are mixed. These compounds had similar effects to topical preparations in 4 clinical trials on over 150 people, but they were ineffective in 3 trials on over 150 people. In 2 clinical trials on 99 people with acne, drinking decaffeinated green tea daily for 4 weeks reduced the inflammatory lesions on the nose, chin, and around the mouth. Cell-based studies found the epigallagocatechin gallate can block fat secretion in the skin and can inhibit a microbe that causes acne. In a clinical trial on almost 400 people, topical green tea resolved skin Mrsa infections in all cases. In a clinical trial on 200 healthcare workers for the elderly, taking green tea catechins at 378 mg per day and theanine at 210 mg per day, it reduced the incidence of the common flu. However, gargling with green tea was ineffective for flu prevention in another trial on over 750 children. In test tube studies, green tea and its components inhibited several infectious bacteria. In a clinical trial on 171 postmenopausal women with low bone density, an intervention with green tea polyphenols and Tai Chi improved the bone formation biomarkers and muscle strength while reducing oxidative damage that can worsen the bone loss. The intervention was safe and well tolerated. However, another study on almost 1,000 postmenopausal women given the green tea extract for 12 months found it ineffective at improving bone mineral density. Epigallagocatechin gallate promoted bone development in cell-based studies. In a clinical trial on 17 people with non-alcoholic fatty liver disease, high catechin green tea reduced the fat content, inflammation, and oxidative damage in the liver. Similarly, it reversed mild fatty liver in another trial on 60 people with high blood cholesterol. However, high doses, 1,315 mg of catechin per day for 12 months, were toxic to the liver in a study on over 1,000 women. The polyphenols in green tea stimulated human hair growth in test tubes and on the scalp of 2 volunteers. Drinking too much green tea can cause an adverse effect associated with caffeine intake. These include anxiety, accelerated heart rate, and sleep disturbances. L-theanine found in the green tea can in turn cause dizziness, headaches and digestive problems. Due to the effects of caffeine on heart rate, people suffering from heart conditions as well as pregnant and breastfeeding women should not drink green tea. Because caffeine has a diuretic effect, people on diuretics should drink green tea in moderation. Some studies have revealed the capacity of tea plants to accumulate high levels of aluminium. This heavy metal can build up in the body and cause brain and kidney damage. To reduce your potential exposure to aluminium, make sure to obtain green tea from a reputable source. Although rare, excessive epigallocatechin gallate over 400 mg per day can cause liver toxicity and even liver failure. Tea polyphenols reduce iron absorption in rats. People with anemia might want to cut down on green tea intake. Epigallocatechin gallate acted as a pro-oxidant rather than an antioxidant in the pancreatic insulin-secreting cells of diabetic mice. Further clinical studies should determine its safety in people with type 2 diabetes. In rats, green tea consumption lowered testosterone levels by 20% and sperm count by 2%, suggesting its potential to reduce male fertility. At high doses, green tea extract induced thyroid enlargement or goiter, and it altered thyroid function in the rats. However, people drinking green tea are unlikely to reach such high doses. Fish oil in combination with green tea catechins can increase fat and glucose metabolism. CoQ10 ubiquinone increased the antioxidant effect of the EG-CG catechins in rats. Curcumin in combination with the EG-CG reduced cancer cell growth. Capsicum vanilloids found in hot peppers, when combined with green tea, had a synergistic effect. And vitamin E in combination with green tea polyphenols improved exercise capacity, lowered glucose levels, and reduced body weights in humans. An ointment with 15% green tea extract is approved for genital and anal warts. Green tea or supplements with active compounds are not approved for any other use, but studies show benefits from drinking 1 to 10 cups per day. You can discuss with your doctor if green tea can help you as a complementary approach and what the appropriate dose for your case should be. You shouldn't exceed 400 mg of the EG-CG catechin, as more has been associated with liver issues. Epigallocatechin gallate generally has poor bioavailability. You can increase the uptake of the polyphenol by taking it in combination with piperine, vitamin C, fish oil, and fasting. Because calcium and magnesium reduce its absorption, you might want to avoid combining it with supplements or food high in these nutrients. For more information about herbs, supplements, and natural treatment plans, check out my website.